So what can we do to improve the outcome of our children? Well, I view stress as almost a potential teratogen, something that really can cause harm to the fetus. And so just as we treat any other teratogen, we really try and decrease the exposure to our families. And so first and foremost, we need to educate all healthcare professionals about implications of maternal stress on child behavior and development. As I said earlier, this is something that's really not taught in the school systems, in medical school, in residency, in nursing school. And so we really need to improve our programs that target the reduction of anxiety, depression, and stress in women. For example, by improving maternal and paternal employment leave, providing flexible work hours is also very helpful. We should really improve breastfeeding support. That's one of my passions again. It has been recognized as a public health issue by the Surgeon General in her call to action on breastfeeding, because we know that helping women breastfeed not only can greatly decrease the risk of chronic illnesses in children, but it can also help mental health in mothers. And in my practice, I always tell my patients, it does take a village to raise a child. It also takes a village to sometimes help breastfeeding. And so I have all my patients, but I'll do prenatal consults and I'll say, why don't you bring any part of your family member, any support system that you have, bring them into your visits with you so that we can talk about the stress and the support that you need to get through this time. It's a very important time. We also need to have systems in place that identify these at-risk women and children and really do this prenatally and postnatally. And therefore be able to screen for exposure to harmful stress and depression in both the women's clinic setting as well as the pediatric clinic setting. It's important to provide families with parenting skills and coping mechanisms because, as I said earlier, you can be exposed to toxics or to stress and really if you have coping mechanisms, you can really move that stress response out of that toxic stress response to a tolerable stress response. And so we should also recognize that that there is a link between screening for stressors and then also providing the families with the support that they need. So you can't just screen for those stressors and then say, okay, you're stressed out, see you later. You really need to be able to provide them with the support that they need. So it's really important for all healthcare disciplines to work together as a team. We also need to give families techniques to help them cope with and manage their stress, and if they don't, we need to intervene quickly. And then finally, we really need to build on the Pediatric Medical Home Initiative, which is actually the model for primary care in the 21st century that has a goal of addressing and integrating high-quality health promotion, acute care, and chronic condition management in a planned, coordinated, and family-centered manner.